My unmute did not work. So I will come back to the first slide and welcome all of you to Using Law and Policy to Create Equitable Communities, a County Health Rankings and Roadmaps webinar. We're glad that you're able to join us today. And I did it much better that time, if anybody believes me.
I believe you.
The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute, and it's a collaboration with the Robert Wood Johnson Foundation. Our program is the result of contributions of many colleagues and partners in Wisconsin and across the nation. My name is Joe Hinton, and I am the person who didn't start the slides quite right this morning or this afternoon. And I am one of the action learning coaches with County Health Rankings and Roadmaps. I am coming to you today from Chicago, Illinois. I want to take just a few moments to introduce you to some of my colleagues. First, I'm joined by my colleague, Justin Rivas in Milwaukee, Wisconsin. Hey, Justin.
Hey, Joe. Hey, everyone. I'll be helping today with the Q&A and answering questions during the webinar. So if you are shooting any live questions our way, I'll capture those up and hopefully get our great guests to be able to share some responses later in the webinar as well. So great and glad to be here. Thanks, Joe.
Great. I look forward to those questions later on. We're also joined by our colleague, Ali Havrilla in Smithsburg, Maryland. Ali is our typing hands in the chat box. Hey, Ali.
Hey, Joe. Glad to be here. And just a reminder that as you are chatting in, to switch over to all panelists and attendees so that we can engage collectively across the group today.
I always appreciate that reminder as well. Thank you, Ali. And the person who reminded me to unmute, our technologist, James Lloyd. He's already served me well today. He'll take care of any technology needs you might have, and you can chat to him as you need to. Hey, James.
Yeah, hi, Joe. I'm glad to be here. And again, instant message me in the chat window if you're having any particular technical problems.
Thank you so much, James. And last but not least, I would like to introduce you to our guest, Sarah DeGaia, who is the Chief Executive Officer of ChangeLab Solutions. Sarah oversees development, implementation of ChangeLab Solutions' long-term goals, priorities, strategies, and budget. She's committed to applying her legal expertise and leadership experience to advancing equitable laws and policies that ensure healthy lives for all. Welcome, Sarah.
Hi, Joe. Thanks so much for having me. Welcome, everyone. Looking forward to our conversation today.
As am I. So Sarah will be back on screen in just a moment to tell us more about the work of ChangeLab Solutions and to share some of their great resources with all of us. But first, I want to tell you a little bit about what will happen after the webinar today. For any of you who are able and would like to, we invite you to join us to dig in a little deeper on today's topic. Right after the webinar, we'll offer an interactive discussion group where you can exchange your thoughts about strategies and about your work as it's related to today's topic. I'm excited to share with you as well that some of Sarah's colleagues, Maya and Alexis, will be able to join us during that discussion. So we'll have some great insights that we can share with each other. The discussion group conversation is a great opportunity to give you a chance to be face-to-face with us and with other webinar attendees and to share a little bit more about your local experience. We always find that that's a really great way to connect with you and with others. We're pleased to be able to offer our discussion group in partnership with Healthy Places by Design. Our friend and colleague Joanne Lee from Healthy Places by Design will facilitate the session, and I'm betting that Joanne is excited to hear all of your voices as well. Later on in the webinar, we will share details in the chat about how you can connect to the discussion group, and it's a real easy, simple process, and we hope that as many of you as possible will be able to stick around. As we get started today, I want to introduce you to a few questions. First, why does the County Health Rankings and Roadmaps exist? Well, we have two big, broad, primary overarching goals. The first goal is to improve health outcomes for all. This includes how long people live and how healthy they are during their lives. Our second goal is to close the health gaps between those with the most and least opportunities for good health. In other words, to increase health equity. Health equity is the notion that everyone has a fair and just opportunity to be as healthy as possible. Notice that health equity requires action. We must remove obstacles to health, such as poverty, discrimination, the consequences, including powerlessness. And we must create access to good jobs with fair pay, quality education, housing, safe environments, safe routes to school, quality healthcare for everyone. If you want health outcomes to improve, taking steps to advance health equity has to be part of your work. Achieving health equity means reducing and ultimately eliminating unjust and unavoidable differences in health and in the conditions and resources needed for optimal health. We do this by improving the health of marginalized groups, not by worsening the health of others. Our progress toward health equity is measured by how health disparities change over time. A big part of our time spent together today will be thinking about how laws and policies play a role in decreasing disparity. Adopting new legislation or policy is one piece of that puzzle, but making sure that those laws and policies are enforced in a way that doesn't disproportionately affect the populations they were meant to help is another major part of that puzzle. I'm curious, and I'm going to ask Ali to do some of the chat magic that I described earlier. I have a question. Have you ever adopted a policy or law that just didn't work out the way you planned, especially as it applied to health equity? And if so, what was it? Please remember as you do your chatting to make it visible to all panelists and attendees. And later on during the webinar, I'll ask Ali to share some of the insights that you're all typing in. This idea of having unequal enforcement of policies and laws hit home to me as we prepared for this webinar today. I shared with Sarah and with the team on the webinar that when I was a teenager, my first job was working in local code enforcement in my hometown of Centralia, Illinois. And while I wasn't part of the team that established those ordinances and those codes, I can remember that sometimes, in fact, oftentimes, the enforcement of those codes, which were meant to improve the quality of life for everyone, weren't equitably enforced. So this really hits key to some of the things that we'll be discussing today. As we spend our time together today, I wanted to center us on a few learning outcomes. Hopefully everyone learned something new today. By the end of our time together, we hope that you will be able to build capacity to analyze policies for their impact on health equity, to consider how to equitably enforce policies that are meant to decrease health disparities, and consider how data can inform your approach to assessing the impact of laws and policy. And I really hope that you'll hold me and all of us to this. Let us know throughout the webinar if you have questions that come up, and we'll do our best to make sure you learn more about any or all of these items. Now at this point, I would like to reintroduce Sarah DeGaia from ChangeLab Solutions. And I'll ask Sarah to start us off. Could you tell us a little bit more about ChangeLab Solutions and particularly the blueprint for Changemakers?
Sure, thanks, Joe. Just want to make sure you can hear me okay.
Sounds great.
Okay, perfect. Well, thank you again for inviting us, and thanks to the entire County Health Rankings team for the invitation to speak to you all today about two of our equitable guidance documents. Well, for those of you who are new to us, ChangeLab Solutions works across the nation to advance equitable laws and policies to ensure healthy lives for all. We prioritize communities whose residents are at the highest risk for poor health. And we do this through an interdisciplinary team of lawyers, planners, policy analysts, and more that work with communities, neighborhoods, cities, and states across the country to create thriving communities. Next slide. Joe, I appreciate you setting the stage by defining and describing some of the key terms and concepts about health equity. For more than 20 years, our ChangeLab team has been working alongside communities to help them address complex health challenges. We know that many places across the country are working to achieve equitable outcomes, but may be struggling with how to do it. And our blueprint for Changemakers is that how-to guide that helps to answer this question. It's grounded in our work to help residents and policymakers develop and advance homegrown solutions that reflect their lived experiences and are designed to create healthy, equitable communities. It's a guide to educate decision makers, practitioners, communities, and other change makers about legal and policy strategies that can benefit children, their families, and the communities where we live. This resource was developed in partnership with the Robert Wood Johnson Foundation and a national committee of advisors that represent diverse communities and sectors. Next slide. So the foundation of our blueprint for Changemakers are these fundamental drivers of health inequities. And because we know that for many people, good health is nearly impossible to achieve. And the burden of poor health, whether it's preventable chronic diseases or diseases of despair, are falling disproportionately on populations of color, on children, on families with low incomes, and individuals with low level of education. And while health outcomes have been improving for some populations, health disparities among low income and communities of color have been widening. For example, Black Americans in 2013 were 30% more likely to die from cardiovascular disease than white Americans. And people with low income and low levels of education were between 46 to 76% more likely to die from cardiovascular disease than those that have a higher level of income and education. And we know that public health's approach to improving health has been to move upstream. That is, we're moving towards solutions that are addressing the root causes of health problems. And lots of efforts have focused on preventing obesity and heart disease, for example, and creating environments that support physical activity and provide access to healthy food. But despite many successes, health outcomes for some populations have not improved enough. And again, we're seeing these health disparities that are increasing at alarming rates. So we believe that we need to move even farther upstream and find ways to change the distribution of healthy environments, economic resources, and opportunities. And this requires a fundamental shift in how policy is used to promote health. So ChangeLab Solutions has identified 5 of these factors that are forces that are creating health disparities: structural discrimination and racism, income inequality and poverty, disparities in opportunity, disparities in political power, and governance that limits meaningful participation. Next slide. So I'm going to dig in a little bit more to talk about why law and policy. Why do we use these as tools to achieve health equity? And the Blueprint for Changemakers has a number of critical frameworks and ideas for how to begin to address these fundamental drivers. And one of those key aspects is law and policy. We often hear that it's the role of the individual actions and behaviors that cause health problems. But in fact, laws and policies are deeply intertwined with our health outcomes because they create the conditions and influence the choices that we have to be healthy. Laws and policies have actually been central to creating many of the health disparities that we see by making resources scarce or creating unhealthy environments. So therefore, achieving health equity will require the use of law and policy to create long-term change. The Blueprint for Changemakers also talks about the power of local solutions because local policy change is more likely to be grounded in that deeper understanding of the local health needs and lived experiences of residents. And local solutions are more likely to create lasting change. We often feel like local policy change is more accessible than maybe policy change at the state or national levels. And local governments have often served as laboratories for change, providing the case studies and evidence to take things to scale at the state or national level. And given that local policy derives its power delegated by higher levels of government, it is important for changemakers to understand that connection between their power, discretion, and authority with those that have been delegated from other levels of government. Next slide. We also very much believe in the power of healthy communities, and that community members themselves, especially those who have been directly impacted by laws and policies, that they need to be a part of the process. And so we have 4 guiding principles that are included in the blueprint that I'll just quickly go over. One is that engaging community members is essential to, again, make sure that the people who are most affected are at the center of policy change. We also want to make sure that we're building capacity, both because learning is a two-way direction. Government is learning from community, and community is also learning from government. We need to understand the roots of the problem to ensure that there's a shared level of understanding about what are the systemic issues that are driving the problems and what are the ways that we can create impactful, lasting change. And we want to make sure that we're aligning action to solve core community problems and that we're really getting at the roots of those problems rather than furthering inequities.
Well, thank you for introducing us to the blueprint, Sarah. And I imagine that there's starting to be some questions in people's minds about how they can use the blueprint and how they can apply it to their community context. And I'm sure Justin will lift some of those up in a little while. If you're starting to have any questions, I invite you to place those in the Q&A box, everyone. Right now, I want to circle back to my colleague, Allie. And Allie, I'm wondering if you've had a chance to scan the chat and think about what types of laws and policies people have lifted up as maybe not delivering what they expected when they were implemented.
Yeah, Joe, thanks for that. And there's been some great offerings in the chat, so I would encourage folks to read through those. And one theme that's coming up is it might not always be the policy, but sometimes the enforcement around that policy, similar to the story that you lifted up, citing that in, especially in tobacco policy and working with homeless. And I'm just scanning in, the chats are still coming in, so as I'm reading, the other one that I would say has been lifted up several times as well is also zoning and zoning enforcement. So some great examples there.
Yeah, live on the fly. I appreciate all those responses coming in, and I think that that idea of enforcement still rings true with me, and I know we're going to get a chance to talk about that a lot more later on today. So thanks for sharing those with us.
Yep, you bet.
As we move on, I wanted to take a moment because what Sarah had introduced to us as we planned for our time together today really got me curious about how we apply data, a data lens, to starting to think about equitable enforcement. So as you heard me say at the beginning, I'm located in Illinois, and as part of my work and as part of my livelihood, I think a lot about the state of education in my home state. So I wanted to show all of you a little bit of the snapshot from my home county, Cook County, here in Illinois, and just highlight a couple of measures and thinking about, in particular, the Some College measure, which is the second one down from the top listed there. You can find that measure and all of the measures on your County Health Rankings and Roadmaps snapshot. But I wanted to dwell on that one because the relationship between higher education and improved health outcomes is well known. Sarah lifted it up just a few moments ago. We know that with years of formal education increasing, we see a strong correlation with improved work and economic opportunities, reduced psychosocial stress, and healthier lifestyles. So, Sarah, if I'm thinking about a measure like increasing the number of people who have access to college or an attainable college credential, what are some of the places we might be aware of inequitable enforcement of policies derailing that goal?
Yeah, thank you for sharing this data, Joe. I think it's really helpful to put one of the drivers in particular in context, which is disparities of opportunity. So let me just take a moment to share what we think about when we're thinking about disparities and opportunity to help answer the question. So when we think about disparities and opportunity, we're thinking about when people or groups are denied quality education, jobs, and other economic opportunities that would support healthy living. So using that data to assess what are the graduation rates, what are the rates of college entrance, can help us understand maybe who's falling through the cracks, who's not able to move forward to get a college education because maybe we're not thinking about or we don't understand why people aren't graduating from high school or where people are dropping out along the way. And because we know that a child's education is really foundational to a student's future well-being and success. And what we've been able to find, sort of looking at different data sources, is that the widespread use of exclusionary school discipline practices, like expulsions and suspensions, and even referrals to law enforcement, are aggravating pre-existing adverse childhood experiences. And they're essentially depriving students of these learning opportunities. Well, how do they do this? Well, first, they end up compounding these feelings of isolation, fear, and stress. And they also deepen mistrust between students and educators, and to some extent, even law enforcement. But school discipline practices are a great example of, they're a policy that is laid out through school district policy. So therefore, they can be changed through laws and policies themselves. We've even seen recent examples of how these kinds of exclusionary discipline practices are used during COVID. And so again, this is kind of a great way to think about how the disparities in opportunity connects to a lived experience of individuals. Next slide. And another way, this is another set of data that has been used over time to understand which populations are disproportionately impacted by exclusionary discipline practices. Not all school districts may capture this data. And so what we've been able to look at, the Government Accountability Office that released a report that was analyzing patterns of disciplinary actions among public schools. And there are basically, several groups of students that continue to be kind of disproportionately impacted by these types of practices: students of color, students with disabilities, and students who identify as LGBTQ. And I think, again, the thing that's really important to note is that these are students who often are already facing higher rates of trauma and adversity. These are students that are overrepresented in juvenile detention populations. And these are the students who, again, are facing these, that are much more impacted by by suspensions and expulsions. So we want to think about which groups of students, again, are disproportionately impacted by these types of policies, and how can we use data like graduation rates or even other health conditions to help us extrapolate, if we don't have access to this data, who are the groups that could be more impacted by exclusionary discipline practices.
Yeah, Sarah, I think this puts it all in really a really strong context for me. And, I have past experiences teaching community college level students and thinking about the kind of qualitative data that I heard from students' stories about the places where they could have been derailed on trying to achieve that goal of higher education or even secondary education, and all of the places where enforcement might have had an unintended impact. So I think I'll turn us a little bit and ask you how you've been able to use the blueprint to identify other issues impacting health equity.
Thank you, Joe. This is really, it's a critical issue, and we've been really thinking a lot about how do we take these fundamental drivers and translate them into concepts or even the questions that we need to be asking ourselves when we're thinking about, how do we address disparities in opportunity or maybe political power. We recognize that there's a pretty significant gap between the promise of the laws that we have as a nation and people's everyday experiences of these laws. And that gap exists in part because laws that are often designed to actually keep people safe and healthy are not being enforced. And then when they are being enforced, they're not being enforced in a way that is actually promoting health and well-being for those who are most marginalized. And this is particularly top of mind right now as we think about COVID-19 and how certain laws are being either under-enforced or over-enforced at this time frame. But really, enforcement actions in the name of public health, we have found can create harm and discriminate against and undermine the kind of health that these laws are really meant to protect. So we published this guide just a couple of months ago. It's available on our website. And the guide covers a number of different issues that I'm going to talk about today. And it provides a framework for policymakers to think through these issues, as well as some examples and case studies from local jurisdictions that have found ways to address the problems with inequitable enforcement. And I want to just acknowledge that inequitable enforcement is particularly an issue top of mind of myself and my colleagues at ChangeLab Solutions, and probably for many listeners, as we continue to process and grapple issues of police violence. And although over-enforcement is not going to be the only issue or primary issue that I'm going to talk about today, many of the themes and solutions I'll discuss are very interrelated to that topic. Next slide. So why is this issue even important? Well, again, we need enforcement to actually ensure that people are complying with public health laws. But we also want to make sure that those laws that were designed to keep people safe and healthy are not being done in a way that's actually going to lead to further inequities. So our public health laws, we think about, they also address fundamental resources for ourselves, right? Like keeping our homes safe, keeping our water safe, and in the case of COVID-19, making sure that people are taking measures to protect themselves and others. So to avoid unsafe conditions and behaviors, again, we need people to comply with public health laws. And this is often done by obligations that are put on individuals and public and private entities. So we want to think about ways to incentivize compliance to make sure that they have their intended effect, but we don't want it to lead to further inequities. So we offer first this definition of equitable enforcement as the process of ensuring compliance with law and policy that considers and minimizes harms to underserved communities. Next slide. Yeah, I'm going to talk a little bit more about kind of when I talk about inequitable enforcement, what do I mean? And usually we're looking at two different types of concepts. The first concept is under-enforcement. And that occurs when laws that are designed to protect communities are not consistently enforced. And this is sometimes, under-enforcement usually happens in communities that are already marginalized. Many times it is because the systems themselves are not triggering enforcement. So Joe, you talked about kind of housing laws and coding laws, and that's a great example because often those laws actually require a complaint from a tenant to trigger an investigation. And so that if the tenant isn't going to complain because maybe they don't speak English well, or because they're an immigrant, or because they have fear of retribution by a landlord, that's not going to be able to like trigger the enforcement. And so those kinds of things may go under enforced. And over-enforcement occurs when laws are enforced more frequently or strictly in certain places or against certain people compared to others. And there's a lot of data that shows that over-enforcement can compound existing health disparities or inequities by exposing someone to greater harm. Like when they're referred to law enforcement, that results in their physical harm or death, or even in the case where it leads to unnecessary financial burdens. And I know we've kind of talked a little bit about tobacco enforcement as being one of those issues. And we also want to think about the interplay between how over-enforcement and under-enforcement work together to undermine people's trust in systems or to undermine their trust in law enforcement overall. Next slide. So we want to consider equity at all different stages of enforcement, from determining when to undertake an action and against whom, to also deciding what are the types of enforcement tools that we want to use. And when we're looking at enforcement policies and laws, there are different aspects to consider. And one of the key questions that we want to think about is, who is the target for investment? And again, we'll kind of think about, so are we targeting enforcement against an individual? Are we targeting against the entities? Do enforcement provisions target actors in positions of power who may be at the root of some systemic problems? So in tobacco enforcement, and this, if you look at the picture, you know, inside of the store, you have someone, a clerk, who is selling cigarettes to someone, and there's no action being taken. Outside, you have a person of color who's being arrested by a police officer because of possession. So I think it's really important to, again, think about who's the target of enforcement, and is that target actually going to root out some of the problems, the systemic issues. So we want to be thinking in tobacco enforcement, for example, there's the possession, use, and purchase laws that can vary from education and community service all the way up to fines, incarceration, and, you know, school discipline if we're talking about a youth. So we really want to think about who is the target. Are we targeting industries and retailers who tend to market more to youth, LGBT people, people of color, and low-income communities? And I think it's also important for us to think about how enforcement targets are identified. Is it a complaint-based system, or is there more proactive enforcement at the top of the issue? We also want to think about the role of victims and communities in enforcement. So again, communities can be really helpful in identifying what are the systemic challenges or issues. And we also want to think about the role of investigatory and adjudicative processes. Are there compounding penalties that are just building upon themselves over time? And is that enforcement entity or the process, is it well funded to be able to actually do its job? And then last but not least, do we have a nice range of sanctions? So are we thinking about, you know, the use of non-punitive actions as well as education, fines, or even criminalization? Why are we using the sanctions to ensure compliance? Next slide. Another issue we want to think about is who is responsible for enforcement and why. So again, is it the individual's actions that have to trigger enforcement? Somebody has to call and complain. And is that going to actually drive enforcement? Is there an administrative body? And this usually occurs within like a local government. There's an agency or department that can issue a citation or a notice or hold a hearing. We've started to see a shift in some local jurisdictions towards proactive rental inspection. So landlords have to register in a database. Code inspectors go out before a unit is rented to inspect it and make sure that it is habitable. And therefore, the landlord and the tenant both feel secure that it meets the standards. So that's kind of a way to use an administrative body to both think about the kinds of way that they can enforce, but also how can they help get people, help get the systems and the actors in a position of being comfortable from the beginning. And last but not least, what is the role of criminal enforcement? Do we want police to be the main enforcement body? It's really important for us to ask how this type of enforcement actually furthers the goals of public health. So again, issues around homelessness came up. We have fines and tickets for loitering and panhandling, but is that actually addressing the issue of homelessness, or is it just targeting the individual? So in some states, cities and counties are authorized to make violations of an ordinance a crime. And this can be a misdemeanor, which could be a fine or even brief incarceration, or an infraction, which again is penalized by a fine, but not incarceration. We really want to think about the impact of criminal sanctions when drafting enforcement provisions, because an over-reliance of criminal enforcement can, again, exacerbate inequities and prompt unnecessary interactions with law enforcement, like we've seen, and I've seen the chats coming up around a lot of individuals who ended up dying in the case because there was an escalation that involved law enforcement that really didn't need to be engaged at that point. So we really want to think about what role does law enforcement and police have in enforcing public health actions. Next slide. So a couple ways to keep equity in mind is, one, where are the power imbalances? You know, are the people who are most impacted by certain policies being protected rather than having their health be at risk? So what is the best way to think about these power imbalances and make sure that they're not being exacerbated through this process? we want to think about the role of compounding penalties versus non-punitive measures, or maybe how they can interact together. So if we think about a simple jaywalking fine, you know, it's obviously designed to protect the road and the individual who from, you know, stepping into the road. But we also want to think about, is that road designed in a way that is going to allow for people to cross the street? And if it's someone who is who has this fine for jaywalking, they have a minimum wage job and they're struggling with rent and food, they receive a ticket they can't pay, which leads to additional fines, which could lead to either a failure to appear or their license being suspended. This can just snowball into something that turns into a really negative situation for someone who's just living at the margins. So ways that we've seen this work in the opposite direction is graduated penalty schemes, where we start off with someone who's subject to maybe education, a warning, some mandatory education, or even a modest fine. And then over time, maybe some severe consequences are imposed. And also thinking about ways that we can impose monetary penalties that are based on a sliding scale with proportional fees. And then of course, the use of non-punitive measures like restorative justice models, and maybe even at this point in time, handing out masks instead of you know, submitting a fine for someone who's not wearing them. And then we want to think about the intentional designation of enforcement bodies. So again, we want to be really thoughtful about who is the enforcement body, and how can that, what are the potential negative consequences? So linking enforcement exclusively to criminal justice systems may lead to inequitable outcomes. So how can we think about our bodies as maybe being, again, proactive in identifying issues that can be addressed before we lead ourselves into a situation where someone has to make a complaint? And then finally, guardrails for discretion are really important, because we need discretion. We need to have bodies that have discretion over authority. But because we don't want to lead it to zero tolerance policies, for example. But it's also important that if we don't have some guardrails for discussion, there's kind of finger pointing or confusion. And so we want to really think about what is the type of discretion that is most important. And this is also where ongoing evaluation and training could be helpful, so that people understand their role around discretion, warning periods, and also assessment tools and evaluation tools to see what's working and what's not. And then finally, what else can be considered in terms of thinking about inequitable enforcement is really engaging the community to really understand and to learn from where, you know, community members are experts in their own local conditions, and they really can provide valuable information to policymakers. In Chicago, there was Mayor Lori Lightfoot created a racial equity rapid response team, and it was really designed to identify some strategies around collaboration that were aimed at addressing the disproportionate impact of the pandemic on African American communities. And so there was a way to help identify areas around education, prevention, and supportive services. And it, again, brought in the community and empowered the community to really both stay informed and healthy, and also ensure that there was connection to government entities. Data collection and ongoing evaluation can be absolutely essential, because we need data to understand where the inequities happening and how do we correct for them or improve them over time. And of course, you know, funding is top of mind. We want to again make sure that the enforcement entities are well funded, so that they don't have to derive their funding solely from tickets, or, you know, create this sort of perverse incentive to actually do fines and ticketing, so that then that creates more inequitable outcomes for individuals and communities. And then training and policy and evaluation updates are really critical as well. So we want to think about, how do we make sure that our enforcement officers are trained so that they know how to limit their bias and enforce equitably, and also consider ongoing evaluation and maybe the changes that could happen as a result of those evaluation findings. So there's so much more information in the guide itself. There's a lot of different questions. There's some really great examples. This is just a sort of a little taste of the ways in which we hope that we can think about and encourage the greater equitable enforcement of our public health laws that, again, are designed to help keep us safe and healthy. I'll just call out that we have, again, these are the resources that I've talked about today, the two at the top, but we also have a number of other resources related to the school discipline practices, helping to create healthy school environments, and even thinking about how do we build healthy, equitable communities. There are trainings for government and community leaders, lots of other resources available, but this is just a snapshot. And then I encourage you to stay connected with us as well. You can follow us on Twitter and Facebook, and also go to our website. There is a ton of materials, and you can reach out to contact us if you're interested in additional technical assistance or just having a conversation around these issues. Thanks again for the opportunity, and I look forward to more discussion today.
Yeah, thank you so much, Sarah. And we're about to kick off question and answer time, but I also want to just call out that there are some amazing conversations happening in the chat. If you haven't checked in a while, I think that every example you shared was really letting people think about where things have gone awry, what the root cause of the inequitable enforcement is, where a policy or law might have been designed with the wrong people in mind. So I think that there's some really great conversations, and I encourage everybody to keep sharing ideas with each other. I also want to note Sarah just shared a lot of resources and her contact information here at the end. All of these will be in the resource guide, which we will send out to you later this week. So if you didn't get a chance to capture them, don't worry. But right now, I want to turn it over to my colleague Justin and to Sarah to share a little bit about what's been going on in the Q&A space.
Thanks, Joe. A lot has been going on, a lot of good questions. And I've tried to answer a few of them in real time as they related to county health rankings, but I have some great questions really for Sarah, I think, that the audience would like to know about. So I'll just jump right into it. One that came in, Sarah, is the question is, how have communities taken health inequities or challenges and transformed them into policy or advocacy actions? And who are the key partners that were involved?
Yeah, that's a great question. So again, there's a couple of examples in the guide, and one example that I'd like to highlight. Well, let me take a step back for a minute and also just note that sometimes it's going to take a little bit of time for us to kind of build relationships. So relationships, I think, are really important. Relationships and data are often really important when we're working with policymakers, because they're going to want to know, like, tell me what is the problem? They don't often have the data. They may have stories, and stories are really helpful as well. But oftentimes it's the data that's really important. And also just thinking about, who are the targets for the audience, right? Are we talking about someone who has the ability, who's either going to champion an issue, or who has the power, who sits in a department or agency? And sometimes we have to work around those folks, because those are the folks that are actually the barriers. And so again, thinking about, who are the influencers that are going to be able to carry that message forward, to be able to address an issue in particular. So there's one example that I just want to call out in the guide, for example, that is from Greensboro, North Carolina. And they really work together to be able to address a challenge and actually bring community members into the process to really think about and engage and make some change in that particular in that particular group. So they first they identified the need to provide like multilingual educational materials on code requirements, because that was a particular local issue that they were addressing and that the state government entity wasn't doing anything about. So you can't use the same, English language documents if you've got multilingual, populations. So they were able to address that. And that really helped to break down some of the barriers around education. They met with residents and property owners to really explain what the enforcement process was. And they began to refer potential code violations to the city. So they used a nonprofit organization as kind of an intermediary, which is often a really good way to do that. And then the city's code enforcement officers began to work with the nonprofit organization to really help to minimize tenant displacement and start to identify those issues that really needed legal intervention. And we've seen examples of this where tenant-based organizations maybe work with a hospital system or a healthcare system that is seeing constant referrals. There was a situation in Los Angeles, for example, where kids kept showing up in the ER and they had to get cockroaches extracted from their ears because the building itself was not being addressed. And so the hospital system started to work with the tenant-based organization to then put pressure on the city, the property owner, to actually take some changes. So we've seen efforts like that. So again, tying the health data, the other resources within a community to kind of pool together those resources to address some of those systemic issues.
Those are some awesome examples. Thanks for sharing. And I think the next question, I think you kind of touched on this topic already in your previous response in talking about the role of nonprofit organizations. But the next question is, how can state government best collaborate and support local communities and jurisdictions in these efforts? And again, you kind of hit on that a bit, but maybe one more time.
Yeah, I mean, this is an issue too, where it's going to depend on the issue and the jurisdiction. So we did a little bit of preliminary research with the city of Berkeley, who was interested in disentangling traffic violations with law enforcement. So they wanted to really understand, is there some other entity who could actually do that traffic enforcement? Unfortunately, we found that it's going to be a problem. It could be a challenge. It may not be constitutional. So we do have to think through, again, those higher levels of government, who has the power, who's been designated with some of the distinctions or the discretion and the authority and the funding. But they're good questions to ask. And I think there's other ways for us to think about, again, maybe we need to be thinking about how do we just minimize the connection to law enforcement, or how can we use some of these other sanctions to help people understand what their rights are, as opposed to just putting these kind of zero tolerance policies or automatically referring to law enforcement.
That's great. That's super helpful. I think I'm going to touch on one more question that came in. So what we did is I want to let the audience know that we did respond to their questions that they submitted when they registered. So a few of these are coming from the pre questions we had. So one more from that group. What do you do when you find that the policy is in place, but has not been enforced in your section of your neighborhood? So kind of this really localized, inequality in enforcement.
Yeah, so there's another example that I wanted to lift up from the guide that came from Illinois, where there was a number of different investigations that were not being enforced evenly across the county. And there was more enforcement actually happening in one particular area that happened to be predominantly Black versus another similarly situated area where there wasn't a lot of enforcement happening. So again, they worked with a kind of intermediary organization that was looking at some of the fair housing laws to help them. They alerted them to the issue, and then they started doing an investigation. They started tracking, when the citations were coming in and when the citations were being enforced. And I think that is another good way to understand, again, where's the data pointing to? And I think if you can't automatically find an organization that can do that data, this is a great way, again, to think about the resources within a community. So doing some community participatory research where people can go out and do walk surveys or other kinds of surveys within the community to even gather that, whether it be anecdotal or sort of community level surveys and data, to then again bring it to policymakers or bring it to organizations who can then help kind of bring that legal expertise or even that policy expertise to then put a little bit of additional pressure onto policymakers, or just to do more investigation on the issue.
That's a great response. That's helpful. I just want to touch on an issue now that came up a lot actually in the pre-questions, and then there was a live question as well, and it really had to do with a bit of an urban-rural divide and how we think about this. And as County Health Rankings and Roadmaps, we provide data for nearly every county in the country, and we have a lot of our audience live in rural areas or represent rural areas. So this was a great question that came in. It said, how can a rural city with limited enforcement resources, i.e. small police department, limited funds, utilize equitable enforcement practices such as incentives, et cetera, especially now during the pandemic times and when rural residents are really struggling? And I think this is a great question. If you have any insight, or if Joe does too.
Do you want to kick it off, Joe? And then I can, yeah, I feel like I've been talking a lot. I'm happy to.
No, and I appreciate the context of the question as a former rural city inhabitant. I think that as Sarah lifted up the potential for there to be enforcement partners, but I really want to think about how I use that word, that are not pursuing punitive enforcement, but kind of corrective or assistive enforcement. So thinking about the not-for-profits that are in the community, thinking about the church, the other religious organization that may be present in the community, to think about what's educational about this or corrective, but not in a punishing way.
I would agree with that. And I think this is where like modeling becomes really, really important. So if you have limited resources, but you have, again, sort of those influencers or key stakeholders who, are modeling the kind of behavior that we want to see. And I know we've seen different examples of that across the nation right now, but really thinking about, the local solutions are, I think, again, one of the things we lift up in the blueprint in particular, because every community is going to be a little bit different and every community is going to have its own needs. So I think there's a way to kind of balance what the local community needs with the given resources that it has. And I think the other piece that we really want to like bring to this conversation, if anybody sort of leaves with something, it's, why, again, who are we targeting for enforcement, and who are the people who are responsible for enforcement? And if there's a way to better utilize resources that is going to help people comply, that is going to incentivize compliance, that won't lead to that unnecessary engagement of law enforcement, that is something that we have seen to be a direct correlation to health inequities. And so how do we really think about the people, like how do we incentivize and have compliance around public health issues that's not going to automatically lead to people needing to be escalated in this way, where people, again, are facing unnecessary financial burdens or who are engaging with law enforcement in an unnecessary way.
Super helpful. Joe, do I have time for one more quick one, or I feel like you're going to.
I think I'm going to have to cut us all off, Justin.
Okay.
Unfortunately, we'll do wrap up, but I just want to say it looks like the Q&A box still has a lot of potentially great questions. So I think anyone who can stay for the discussion group might want to carry those over. Or if there's something that you can't stick around and ask, you can always reach out to our team or to the ChangeLab Solutions team to continue having this conversation. But thanks, everybody. Let me grab the screen back. And I want to advance a little bit because I still have a few items I would just like to share with everyone. We heard a lot about evidence and selecting policies and data. And so for maybe some of you on the call today, I'd like to introduce or maybe reintroduce you to the What Works for Health portion of the County Health Rankings and Roadmaps website. The What Works for Health section of our website is a great place to really get local with your strategies. That could include policies, it can include program implementation. It's an database of over 400 strategies. You can search by keyword or by health factor area. So I really hope that everyone will spend some time as they continue to think about this topic of policies and how they're equitably enforced. Quick commercial for the What Works for Health team. They are always updating that portion of the website. So I just wanted to call out that they have a few new strategies this month. Check them out if you haven't yet. The Universal Distracted Driving Laws strategy and the Community Fitness Program strategy. So you can see these can come from any area of your work, but take a look and see what you think. And we're, of course, always available to talk through those strategies with you. I also want to lift up our action learning guides from County Health Rankings and Roadmaps. These are an interactive space for you to practice guidance, tools, and really some reflection on community stories to think about growing within a particular topic or question. You can see on the screen there, I've got an example from our What Are Data guide. So if you're working with a partner or a coalition that would benefit from a little bit of an enhanced learning environment for a question like that, the action learning guides are a place you can practice that. And you can see on the right-hand side there, one of the graphics from our Understanding Root Causes action learning guide. I think that you would really benefit from thinking about that as a lot of you pursued, the ideas of structural racism or inequitable policing in communities, and where the root causes for some of the things we see in our communities are really growing out of. So I invite you to spend some time with either one of those guides or all 9 of them that exist on the website. As we wrap up, I also want to tell you about next month's webinar. I'm excited to tune in as our colleague Attica Scott will be joined by Dr. Tori Harris and Dr. Ira Murray as they think about conditions for racial equity through resident engagement. So that's on Tuesday, December 15th. And you can find out information about that webinar and all of the webinars that we have at countyhealthrankings.org/webinars. One last commercial for the discussion group before you'll start to see some links in the chat for you to engage with us a little bit more. Right after the webinar today, we'll be going to that discussion group. Some of those unanswered questions that you might have are going to be starting us off. But I'm also going to get a little bit of a chance for some quick feedback before we leave for the discussion group. So I'm actually going to ask our colleague James to launch a poll at this time. And you can see on your screen right now that we're just asking for a little quick feedback on what happened today. So the question is, my understanding of strategies to analyze policies for their impact on health equity has significantly improved, moderately improved, a little improved, or not improved. Tell us what kind of work we have left to do, what we might hear from you about. I know that Justin will be paying attention to this as he gets ready to join the discussion group. I'm going to end the poll here, Justin. Yeah, it looks like we've done some of the work from today. Got a little bit more work to do. So we'll definitely be thinking about that as we prepare for the discussion group here in just a moment. All right. Let me go back to my slides here. In the spirit of hearing from you and improving our work, we're also going to chat to you a link to complete our quick questionnaire. We invite you to open that link and let it sit in a separate browser window for just a little while. And then once the webinar is over, we hope you'll answer those few questions and give us some feedback about how it went today. I invite everyone to connect with us on Facebook, on Twitter, sign up for our newsletter on the County Health Rankings website. And as I said before, feel free to use the contact us feature on the website or reach out to anyone that you've heard from today to talk more about the topic. So I'd like to thank everyone for joining us today. I have really enjoyed the conversation and I've enjoyed spending this last hour with you. If you check out the chat right now, you're going to find out how you join that discussion group. Just a few quick questions and you'll be sent to another Zoom meeting. So thanks a lot, everybody. Have a great rest of your day.